Okay, so we're now looking at the lateral joint line. So the knee is extended, as you can see, and what we can see is the bony anatomy. So we see the we see the femur here, and then we see the tibia going down. Yeah. So what we then have in between here is the lateral meniscus, and we can see the outer contours of the lateral meniscus. The little dent here is where you can see a sort of rounded structure, which is the popliteal tendon in transverse, and that's very clearly demonstrated. And then you can utilize the angulation of your probe to introduce some anisotropy, and that will help if you, in case you find it difficult to distinguish, for example, the popliteal tendon from the surrounding tissue, and you can sort of do that equally at the lateral aspect of the meniscus. You can do the same thing, so you can see the contours of the meniscus. And we just scan now a bit more through the joint, posterior a bit more, and then anterior, so that you can really see the contours of the joint line and the contours of the meniscus at this point.